Children, today let us discuss about the GI infestations in children. GI infestation, it is nothing but gastroenteritis. It is nothing but it is the inflammation of the digestive tract, and which it involves vomiting, diarrhea, or both. It is sometimes also accompanied by fever or abdominal cramps, and it is usually caused by virus, bacterial, or parasitic infections. It is the inflammation of the digestive tract, and which involves the vomiting, diarrhea, or both, and sometimes it is along with the fever or abdominal cramps, and the general cause is viral, bacterial, or parasitic. Most of the gastrointestinal infections. What is the most common gastrointestinal infection? It is mostly due to virus, and with norovirus being the most common, whereas bacteria and parasites are almost important contributors to acute and chronic gastrointestinal infections. And here the species mostly cause the hospitalizations and deaths in the United States due to GI infestations. That is, the commonest cause is mainly virus and mostly the norovirus, and sometimes by bacteria and parasites also. Non-typhoidal salmonella species also cause, sometimes due to the hospitalization, and usually were the GI disturbances. And what is the most common cause of the pediatric gastroenteritis? Let us see. In the industrialized world, the most common causes is in children are mostly virus, bacteria, that is food poisoning, and due to intestinal parasites. And viral gastroenteritis, usually it is seen in the healthy children also, and viral infections of the digestive tract often responsible for mild episodes of gastroenteritis and death. And what are the more common malformations include the esophageal atresia and the fistula, intestinal atresia, malrotation, and with valvulus and anorectal malformation, gastrointestinal infections in babies, gastrointestinal infections usually caused by virus or bacterial infections. The gastrointestinal infections are viral, bacterial, or parasitic infections, and usually they cause the gastroenteritis, and inflammation leads to the GI tract involving the both stomach and small intestine, and the symptoms usually are diarrhea, vomiting, and abdominal pain. Dehydration is the main danger of gastrointestinal infection, so rehydration is important, but most gastrointestinal infections are self-limited and they dissolve in within the few days, and usually they need healthcare setting in specific populations, that is like newborns, infants, and immunocompromised patients and elderly people. These patients need more importance to have the healthcare, that is newborns, infants, immunosuppressed patients, and elderly patients, because they will have less immunity. And usually the diagnosis and treatment and infection control measures should be promptly given. And here the infections can be caused by a large number of microorganisms, including the adenovirus. Good morning. Adenovirus can cause diarrhea, fever, conjunctivitis, bladder infections, and rashes. And most common symptom is respiratory illness. After rotavirus is the most common. Here Campylobacter is also the one of the most common bacterial infections, and usually it is frequent in children under 2 years of age, because it is usually foodborne, and usually it is spread through raw or uncooked meat and contaminated milk. That's why it is common in children. Clostridium infection, it is responsible for about 25% of cases, and due to antibiotic associated diarrhea, this is usually seen in hospitals and healthcare institutions, and usually we can see in elderly and compromised patients. These are at most risk, and they will have highly toxic and resistant. There, there will be outbreaks also sometimes, and this leads to the increased morbidity and mortality rates. Coming to the worm infestations, usually these are the helminth infections, and usually they cause these are the commonest diseases in children and living with extreme poverty. And in addition, they will have the intestinal helminth infections also. Usually, with this, what are the worm infestations? Means it usually children will complain of stomachache, and leading to this, they will have more parasites such as worms, and usually they will these worms will live in the intestines and feed over your child's nutrition, and they becomes more increased in number. These are mostly the common types of tapeworms, roundworms, pinworms, and threadworms and hookworms. And these worm infestations are related infections and common. What are the symptoms of worm infestations? Some common symptoms of worm infestations are irritability, weight loss, stomachache, bedwetting, blood in stools. Besides this, distant symptoms are listed. There are jaundice, nausea, vomiting, loss of appetite, and eating too frequently. Usually, these are seen in malnourished children. Roundworm infestations. Due to roundworm infestations, we can see diarrhea, passing worms in stools, dry cough, and fever. In pinworm infestation, you can see itching around the anus, trouble sleeping due to itching, and painful urinating. As children are quite dynamic and active, they tend to come in contact with germs easily, and this include usually there's coming in contact with this infected surface as soil containing eggs or germs. So when they play in the ground, touch pets infected with worms, consuming infected food or not, and improper hygiene, inadequate hand washing. Usually, these are diagnosed by thorough examination of the child, and most infections can be easily treated and by giving anti-parasitic medications and anti-worm or deworming medications every 6 months. It is advisable to seek the professional advice from a doctor, and it is important to follow good hygiene practices along with medication for quicker and effective recovery. Worm infestations can hamper children's health, and both the team of the skilled and experienced doctors or specialists in handling and children and can easily resolve the worm infestations. Expertise is only complemented by excellent infrastructure and the technology. Purna, thank you. Hope you understood about the GI infestations in children.